Welcome back to Born for This Stories, where we speak the truths no one told us, so you don't have to carry this alone. Today's conversation is about something that doesn't get talked about enough in medical parenting spaces. It's not about rejecting medicine. It's not about distrusting doctors. It's about discernment. It's about informed consent, second opinions, and the courage to pause when something doesn't feel aligned. We are joined by Katherine from the podcast Moms Off the Record, a show that challenges cultural narratives around motherhood, health, and authority. What I appreciate most about Katherine is that she doesn't operate in extremes. She asks questions, she looks at systems critically, and she encourages mothers to think deeply before making life-altering decisions. In today's episode, we talk about her own childhood surgery story, what informed consent truly means, and why sometimes the most loving thing you can do for your child is to keep asking questions. If you've ever felt intimidated in a medical office, if you've ever wondered whether you should seek another opinion, if you ever felt pressure to decide quickly when your heart needed more time, this episode is for you. Let's dive in. Tell us about yourself. Do you want to go by Katherine or Kat?
I'll go by Kat.
Okay, Kat, tell us about yourself.
Yeah, so I'm a mom of two toddlers. I have a daughter who's a year and a half old. She was born at home birth after cesarean. I have a son who's 3.5. And they're the loves of my life, as well as my husband. Yeah. So we're in Southwest Florida. We used to be in St. Pete, and we had so much fun going to your practice. But we're in Fort Myers now, so a couple hours south of you, and moving to Sweden in the summer. I'm also the host. Yes, very excited. But I'm the host of Moms Off the Record podcast. We are now in season 4. And and I'm also a potty training consultant. So that's a little bit about me.
Yeah. Oh, yeah. And I always forget that little tidbit. That is like super cool. And I'm sure people are like, what in the world is that? So you can like sprinkle that in along the way and hopefully enlighten some listeners.
Yes.
For sure. Well, tell me a little bit more about what led you to start Moms Off the Record.
Yeah. So at the time, it was with my former co-host, April, and and we were my mom set us up as friends. And so we were chatting a lot. I was about 3 months ahead of her with my first pregnancy. She was in her first pregnancy. And we just realized as we were texting each other that we were going down the exact same rabbit holes: vaccines, circumcision, homeschool, like everything. And we just couldn't stop researching. It was so much fun and, asking tough questions. And so she asked me one day, like, so when are we going to start our podcast? And I was like, yeah, I don't know. I mean, I was like, we're about to have babies, but that'd be really fun. We love podcasting. So it just started in our respective living rooms. And then, now it's in season 4. So I am the solo host now, but April and I had a wonderful run of 3 years together. And we've had some really awesome guests on, and we've learned a lot. I've learned a lot. So we talk about in the podcast, it's a lot of topics that moms are too scared to talk about with their mom friends, especially new mom friends. They're too scared to ask these questions to their moms or their doctors. And it's a lot of subjects that moms tend to really tiptoe around because, they're just trying to be nice, or, they're scared of confrontation. So it's a lot of, I would say, unorthodox perspectives, and it's completely uncensored.
Yeah, which I love, and which is one reason I so wanted you on our podcast, because I want people to hear your voice and your story and empowerment, because navigating the medical world in general, even no matter where you fall on the spectrum of medical and holistic, there's just more questions that need to be answered, more push. And I think the assurance inside of ourselves, especially as the moms and our mom gut, that it's okay. So
yes.
I'm
absolutely. Yeah. And so this story of, getting second and third opinions, the story that I'll go into, it really dates back almost 35 years ago, which is wild. So I think a lot of my personality traits of being a skeptic when it comes to the medical institution, one, it's ironic because I came from a medical family, but two, I actually got that from my very own surgeon dad, who is skeptical of other providers.
Yeah. Yeah, yeah, for sure. For sure. I know. When you first shared the story, which I know you go into, I was like, wow, this is like really powerful to hear like all the perspectives on it. And it's so interesting too because you were so young, right? You were
Yeah.
a baby. Was
Yes, a
that
year
correct?
old.
Yeah, a
Yeah,
year
give or
old.
take. Yeah.
So that has also shaped you into how you think and ask questions. And so it's
Yes.
very cool to see. Very cool to see.
Thank you.
This,
What was it that initially had you kind of flip when you're brought up a certain way?
Yeah.
What made that transition and opened your eyes to look other ways when you have a surgeon father, one can assume you're going to live that lifestyle and
Totally.
traditionally medicine wise.
Yes, it's interesting. So my dad was a surgeon, but then on my mom's side, I had a very unique situation where my mom's uncle, so technically my granduncle, lived with us, and he was very much like a mom, a dad, and um, even though I had both parents intact, it was a very close relationship, not in like a weird way, but he was like a wonderful part of our family. And he was the one when I was just 10 years old. So this is when like my eyes started to really open up at an unusually young age. So in the year 2000, Y2K, I was 10. And that's when he started talking about like GMOs and antibiotics and hormones being in cow's
wow.
milk and how so all the way back, 25 years ago, he's already saying like, oh yeah, girls are starting to go through, you have to be careful. Like girls are starting to go through puberty earlier from all the hormones and the antibiotics in cow's milk. And so he actually worked at a health food store. So it's funny on my mom's side, it was more like the holistic, kind of like, old school hippie mindset around like, we should eat real foods. Like we're not going to do margarine. Then on my dad's side, it was more like acute and like emergent care. So I sort of had that yin and yang approach growing up. So
For sure.
GMOs and the Y2K that opened my eyes. And I started actually packing my own lunches to school. It's either like if you were a kid at my school, your mom would pack your lunch for you, or you're just getting the school lunch. But
Right.
I was like, well, my mom said, sure, you want to bring your own lunch? Like, I'm busy. You can make it yourself. Like, we have tons of food in the fridge. And I was like, okay, that sounds great. I noticed immediately I looked better and I felt better, and I had more energy. So that's like, I opened my eyes there. The other example of when I really opened my eyes to like something's not adding up here. I remember, so my mom was a pediatric nurse. Well, she was an RN, and she did a lot of time in pediatrics for 13 years. But she actually worked for a very crunchy pediatrician, a female pediatrician who like practiced extended breastfeeding with her daughter for a few years. She was like the head of La Leche League. She
Love
saw
it.
like almost all unvaccinated patients. This was in the early 90s.
I love it.
Yeah, so this was like, almost unheard of, kind of
Yeah.
pre-internet or just, really at the precipice of internet, right? So, sort of underground, like cool families. And she almost never gave out antibiotics either. So, it was interesting when I just entered middle school, so it was like the year 2002, the school nurse came in and did a presentation on why it was so important to get a flu shot. And I remember just being at that, I was so skeptical. One, I was like, why are they trying to push? It really felt like a hard sell. Like, why are you trying to push a flu shot at school? I had never questioned vaccines or anything. But that was actually the first time my mom really started to question things because admittedly I was vaccinated, but not with everything.
Yeah.
So my mom was scrunchy, you could call it,
Yeah.
but not pro-vax, just like scrunchy. But now she's against them all. So I came home and I told my mom, like, so their school nurse is saying that we need to get the flu shot and that we're gonna have to like get boosters. Now we're supposed to get it every year. So my mom was like, "What? Like the flu shot? We just had the flu when we were growing up." And then, my grandma would bring us chicken broth, like you'd just watch TV, you'd rest, like
hmm
so she said, "You're not getting that thing." And then later on, same thing with the HPV shot. And then my
Oh,
mom just
yeah.
laughed in the pediatrician's face when the pediatrician told her, like, "Oh, and your son is going to need an HPV shot." She said, "No, he's not." And
Yeah.
like, bye.
Yeah.
That's
Yeah.
insane. So at a very young age, at the earliest time I can remember like waking up to the nonsense was probably 10 years old, right? So like GMOs, flu shot, HPV shot. And once you have that initial reckoning, that moment of waking up, then you start to of course ask yourself like what else have I been maybe lied to about?
hmm
You realize you can't really just trust the expert in the white coat.
Yeah. Yeah. Yeah, it starts to open your eyes and you start to think and this of course is still like before like so much information on the internet. And
Yeah.
so you were like exposed to it at such a different time versus now. Oh my gosh, like how do people even know what's right or wrong because there's just every opinion out
Yeah.
there. And so this is why like these conversations are so important to help like just help other caregivers like navigate these different spaces and ask these different questions and help empower them for sure.
Yes.
Yeah. Oh, that's so interesting. I love that your uncle was like on it in the beginning.
Oh, yeah. He
I
was
love
like
it.
the OG crunchy dude. And
Yeah.
again, way before the internet. He never even knew how to access the internet when he was older. He
Yeah.
was just, old school just by living it and by reading a lot and having conversations when he worked at this health food
Yeah.
store.
Yeah.
Um, and it wasn't considered extremist, to be
Yeah.
into any of this. In fact, it used to be like the Uber, like more of like a hippie
Yeah.
situation. And
Right.
it's funny how the pendulum has swung.
For
And
sure.
yeah,
Yeah.
culturally, but yeah.
Well, now that I totally like just didn't even like put this together. Like as I was growing up, my mom became a massage therapist. So like once she started that career, like that's when our life really started to change more like holistically and like turning the lens on that. And she just started to eat better. And of course, we ate better because of that. But she also like dealt with chronic pain from multiple bad car accidents. And the only thing that helped her was massage. So that's why she became a massage therapist and then cleaning up her diet and nutrition and just managing that way. And she would also, because she was a single mom, like she would massage like at times like up in the extra room of the health food store. And
Oh,
this just
amazing.
jogged my memory. And then she would like help like with the owner like inside the store. So like we spent a lot of time there. And like I it wasn't like super busy because this was back in I mean, gosh, I was probably 12 or 14, like my preteen age. And so it wasn't like super busy, but like it was just such a different way of life. But that's what I was used to. So at that point, so I never like questioned it. And I'm sure those conversations were probably being had like inside those walls, and I wasn't even acknowledging it.
Exactly. And now it's like, take that same situation. Okay, car crash. You go to an allopathic doctor, and they're probably going to want you to be on some sort of pain medication.
Yeah.
There's not going to be a conversation about massage therapy and food. That you're going to have to figure that out on your own.
For sure. I mean, she was in pain management, and I remember like it just was not good, like at all. And like it
Yeah.
wasn't helping her, and she couldn't be present with us. So there's like a big shift that needs to happen. And like, thank goodness she like empowered herself to do that because like that's not what's being talked about. And this is a complete and other tangent. Like, obviously, like I'm in the chiropractic space and like I see all kinds of patients. I just had a patient recently come in and I've been seeing her for a while, but she ended up in pain management recently. And they gave her some sort of new medication for some sort of new diagnosis that she had because they can't figure it out, which is, whatever. And they didn't properly give her informed consent, which is also why this
Mhm.
conversation is so good today because they sent her home and I think they said something to the effect that she told me of like you may just be like really sleepy or like not feel like super great for like a couple of days. She was vomiting. She was like not really able to like make it through her day. She's calling them and like is this normal? And they're like, "Oh, yeah, that's totally a normal side effect." I'm like, "They didn't tell you?"
Wow.
And she is at home by herself because her husband's away working. And I just like my heart bled for her because there's like she was doing better when she was getting cupping and adjustments, but of course she stopped coming in because they were like, well, let's just see how this stuff works. And then it spun her into this complete and utter like crazy side effects. But I then also had to ask her, like, how many medicines are you on? She's like, I don't know, like 7 or 8. I'm like,
Wow.
oh, well,
That's normal
also,
now.
yeah, I'm like,
That's
also
normal.
they could be crossing over and having other side effects that they didn't actually prep you for because they didn't know about that. So, I'm again, it's just like ask the questions, ask
Yeah.
them and press them because that's not proper informed consent.
No.
That
And
you may feel
sadly,
a
we
little off.
we can no longer really assume. We shouldn't have ever really assumed that they're going to proactively tell us, rattle off the whole list of side effects. Unfortunately, we're in a situation where the onus is on us to do the
Mhm.
asking. You need to know the
Mhm.
questions to ask. It's not our fault. It
Yeah.
shouldn't be this way, but that's what it's become.
Yeah. Yeah. Well, I think we're kind of trained, right? Like as you go through that system, you're trained. I mean, think about it, like the commercials tell you, like, ask your doctor for
Yeah.
this, this, and this. So we're trained and conditioned that we should be asking for certain certain treatments, but we're not trained to ask, like, okay, well, tell me the pros and cons to this. And
Yes.
this is my whole like chart. Am I a good fit for this?
Right.
Well, back to the flu shots. Most people never read the inserts of the flu shots,
Oh, yeah.
and there's so much information in there about the downside of them, but
Yeah.
people don't
And
want to
how
even
there's,
inform themselves on it.
yep, waning efficacy with every booster. And how, I mean, why are we even talking about getting a shot for something like that? I mean, truly rest, time, broth, you know,
Yeah.
these have worked.
Oh yeah. I know.
They actually work.
Yeah. I call it like you got your immune system boosted. Like we have
Yes.
to do these things so we have a stronger immune system.
Yes.
So it is. And again, like I know a lot of medically complex children have weakened immune systems. So we're not downplaying any of that stuff, but we definitely want to empower that there are things to do and
Oh, yeah.
ways to combat that. And that was part of like our journey as we were going through things with Silas is like we wanted to support his immune system. We wanted to support his detox pathways because for us as a holistic family, if we had to go down this path and do multiple rounds of antibiotics and anesthesia, like at such a young age, I knew the side effects of a lot of those things. And I wanted to make sure his body was as strong and stable as possible to get through that. And we did have one instance though through one of his surgeries. I think it was his second one because as they get older, of course they don't want like as people on them. And the anesthesiologist came in and he was like, "So we want to encourage like giving him like some sort of nasal spray. It'll help like sedate him a little bit, so that way we can actually do the anesthesia on him without him like freaking out." And I just asked as wanting to be a well-informed parent, like, what are the side effects? And he said there are none. And I
Yeah.
just kind of looked at
It's
him and
wild.
I was like, well,
Impossible.
that's impossible. Like there's a side effect to everything. So don't tell like I
Yeah.
understand like the risk probably like the benefit probably outweighs the risk as far as comfort and doing this. But don't tell me there's no side effects because I know that there are.
Yeah, it's crazy. It's almost like I'm guessing that now they're annoyed with parents asking too many questions. Not that there's ever a time you can ask too many. And they're going to interpret the question. They want to be like, "Oh, she really wants to know what are the worst side effects or how likely are they?" So let me just quickly downplay it, you know. But yeah, you have the right to know,
Hmm.
no matter how small or rare a side effect is, you have
Hmm.
the right to know.
Yeah.
And it's never been easier to look up what the side effects are nowadays. I mean,
Yeah.
imagine pre-internet
I
having
know.
to figure this stuff out at the library or
Yeah.
going to a source you trust.
Yeah. Well, right. And when I think it was that second surgery, I remember him coming off the anesthesia. We were home and he was aggressive. Like he was waking up and like he was like banging his head on the crib and I was just like on Google right away like is this a side effect of like coming off the anesthesia and like it coming out of his body and like all over Google it's like yes, like aggression, all the things he was doing, but they never told me that was like
Something to
a
expect.
way that he could respond or something to expect to prep myself. And I'm just like beside myself because I'm like, oh my gosh, like this was one of my biggest fears that like this was going to change him forever, like mentally.
Yes.
And I just had to kind of sit inside of that like 2 week time frame to see if it got better or if it didn't because I was
Yeah.
already doing the things to open his detox pathways and that was hard. I mean, it was really hard because you don't want to feel guilty about doing something that you thought was the right choice for your child, but also like I had no idea. They didn't I'm not blaming them. Like I take responsibility of like the choices we made, but like I had no idea that that could have been a side effect of coming off the anesthesia.
Right. And it's like, why should you have to learn that way? So, I mean, really, what the provider should have done is said, these are all the side effects, right? And then um, even if it's, yeah, so going back to what I was saying, even if it's like rare or a small side effect, but I'm wondering, like, why don't they share this? Because either they don't know or they do know and they're hiding it. So why are they hiding it? Are they afraid that you're going to choose not to do the anesthesia? So it's like, yeah, maybe you still would have chosen to do the
Hmm.
anesthesia, but you don't want to feel blindsided. But
Hmm.
now the problem is this individual is making people lose credibility in
Hmm.
anesthesiologists, right? So
Yeah.
it's just this horrible feedback loop of distrust.
Yeah, and I put myself in these shoes often being a practitioner because like the risk with chiropractic is extremely low. However, we still have to like tell people, and we still have conversations about financials and their x-rays and all these things. So like I put myself in their shoes often and try to like flip the script and think about like how could that person be feeling, or like how much information. And I've seen where I've overshared, like I share so much information with patients and they only remember certain things. It's like then
Right.
you're kind of drinking from like a fire hose, and it's a lot. And so, but with this movement and being inside of this space to help provide more support for caregivers, I would hope that maybe at some point we could have like even a sheet of paper that goes home with you of like, these are things we did not get to discuss because, of whatever. And we want you to remember because they're important. But, your child could have this at home. This is a way to support it. Or, if you feel like it's an emergency, call us or whatever. There should just have been more
Oh, yeah.
of an afterthought, because there was an afterthought on how to handle wounds and dressings and all of that, but there was no afterthought of like probably in their mind something that was smaller. But when
Yes.
you're a parent and you've never gone through it, and your child's behavior changes like that, it's not small.
Yes. I have a very similar analogy I can draw with the story from when I was about 1 year old and what happened. How when a provider is deeply in their own world and they do this kind of thing day in, day out, they're not going to think that something like what you experienced is big enough of a deal to even talk about because they're so numb to it by now, which is
Mm,
crazy.
yeah, I can see that.
And so yeah, my situation was in around 1991. I was about 1 year old. And at the time it was like right below my eyebrow and above my eye, it was this bump. And at first people are like, okay, is this like a pimple? But that's weird. She's one. But it was gradually growing.
Hmm.
So then it's like, okay, is this a tumor? What's going on here? So my dad at the time was a resident. And so he was in surgery residency at NYU Langone, which is kind of nice to be well connected that way, to be able to ask a bunch of different experts
Absolutely.
right there. So, but, some of it's just interesting dynamics at the time. So, residency, grueling, brutal, insane hours. So, my mom was a nurse. Thank goodness we had my grandparents who lived, just like walking distance. This was all like in Queens, New York. But again, interesting because I do think about how this was a very scary time and with my medical issue. And this was like very much pre-internet. But, you don't know what you don't know. So you don't know what you're
Hmm.
missing out on, the ease and convenience. So this kept growing gradually and gradually, this bump above my eye. And my dad was like, okay, first, we're of course going to ask the pediatric neurosurgery team at NYU Langone because I'm right here and it's supposed to be one of the best in the country. I think this is important to highlight. Just because some places one of the best in the country does
Right.
not necessarily mean they're going to get it right.
Right.
So you
Right.
have to always keep your eyes open. You can't just let your guard down. But you have to balance that because you don't want to just distrust everything everyone tells
Yeah.
you or you're going to drive yourself nuts. And this
A
is
hundred
where really
percent.
discernment comes into play, right?
Right.
So the neurosurgery team at NYU Langone, what they proposed to my dad was let's do a craniotomy because what they thought it was, so the working diagnosis, like the preliminary, this is what we think it is. They thought I had an encephalocele or a hole inside my skull where brain matter was protruding outward and that can grow and grow and grow. So here's the issue though. When you do a craniotomy or you're opening up the skull, I mean, of course it's irreversible. And what if there was no hole there, right?
Yeah.
So this is just a working diagnosis, right? So I really want to break this down slowly for people like
Yeah.
this is not definitive. Even if the doctors say I really feel in my strongest opinion this is what it is, it's still a working diagnosis. We
Hmm.
do not have evidence.
Hmm.
So my dad, like the very first question was, okay, so what are all the consequences of just doing the craniotomy, opening up the skull? One of them is lifelong seizures is
Wow.
possible.
Wow.
So my dad's like, so wait a second, you're suggesting the first line of defense is we open up the skull, but you don't even have evidence that there could be a hole inside with brain matter protruding, but you're just assuming that's what it is? Yes. So he's like, no. So that was an immediate no. If
Yeah.
that's your only option, we're going to the next team. So then They went to Mayo Clinic. Again,
Hmm.
one of the best in the
Yeah.
country, right?
Yep.
Most parents would be like, Mayo Clinic, they have all the answers. So, same deal at Mayo Clinic. They said craniotomy. So, my dad told me as he was remembering this story, he's like, your mom and I, when we walked into Mayo Clinic, we remember in the pediatric unit, we remembered seeing a bunch of kids like just drooling and hanging over wheelchairs. And it was
Oh,
very upsetting and distressing. So, and then to see that, when the doctors are just very routinely explaining, like, yeah, we're just going to open up her skull. We don't know if there's a hole in there or not. We're just going to check it out and then, sew her back up. My dad, it was a really stark reminder for my dad. And again, he's in residency to be a surgeon. He's opening up
yeah.
people every day, but adults. Like, that's it's very unsettling, and that's their normal. These surgeons, they live and breathe this stuff.
Yeah.
But when you zoom out, it is a big deal. So don't try not to let them gloss over things like, yeah, it's just a craniotomy. So then my dad still didn't like the answers at Mayo Clinic. So ultimately, he and my mom went to UPenn Children's, and this is where they got the best vibes. This was the third opinion: best vibes, best care. So, some turning points here. One of the surgeons said, you know what? We actually don't know definitively whether this is an encephalocele. So that was the first time my dad heard, we don't know.
Yeah.
This
Yeah.
is an Ivy League, school, one of the best departments in the whole country. So that like actually gives parents it can actually build some credibility with a provider when you
For
hear,
sure.
I don't know.
For sure.
But my dad proposed, he said, if the working diagnosis is just encephalocele, because that's what we see at the time on the scan, the ultrasound, and of course, technology's come a long way since
Yeah.
1991, but that's all we have. Could it be possible that it's not an encephalocele? I don't know what it could be. Can we operate on it from the outside without doing the craniotomy? So we can avoid the risk of lifelong seizures.
Hmm.
And so my dad proposed this to them. This wasn't even his
Wow.
specialty.
Yeah.
UPenn said, you know what? Yeah, we can do that. Okay. So my dad's thinking like, why didn't they just propose that at NYU or Mayo Clinic? And the truth is, again, this is their bread and butter doing craniotomies. They don't care.
Hmm.
Of course, they care. Let me take that
Yeah.
back. They care. They care deeply. That's why they went into this. But craniotomy, doing that to them, it's like if we just have a glass of water. You know what I mean? It's not
Yeah.
that big of a deal. It's not
Yeah.
their child.
Yeah.
So, yeah, they operated on it from the outside. And guess what? The working diagnosis of encephalocele became the definitive diagnosis of benign hemangioma. So,
Wow.
my dad ended up speaking with, it was a pediatric, what was it? Oculo specialist.
Hmm.
Basically, if the hemangioma, because it wasn't cancerous, it wasn't malignant, it was benign, but if it was not removed, it would have just continued to grow and grow and grow and eventually make me go blind in one eye. And then the other eyeball would have been looking in a completely different direction. So, going back to like, what are some questions to ask? Is this the working diagnosis or like the actual diagnosis? How do we know?
Right.
The other one is it's just simple. What happens if we do nothing, right? So my dad, this is like using a lot of discernment. My dad and mom together, but my mom let my dad take the lead, obviously, because he's in residency to become a surgeon. She's an RN. Of course, she has a say. Of
Yeah.
course, they're on the same page, but she's more than happy to be like, yeah, I'm letting you take the lead. Like this is your business, basically, your bread and butter. So um, yeah, what happens if you do nothing? I love that question. Well, really bad things will also happen if you do nothing. Okay, so
Yeah.
we know we have to intervene, but we don't want to do the most extreme intervention.
Hmm.
That's too risky. So then it's like, how do you balance interventions and then like time that's lapsing? You have to know, you have to ask, like, is is this urgent? Like, do we need to act right now? What happens if we don't act right now? Okay, so my dad knew we had a couple of months. Like, it's not so big that it's going to block my eye
Yeah.
in a couple months, right? So if it just is looking funny and it's uncomfortable, but I haven't gone blind, we have time to get these second and third opinions. And my dad wasn't going to stop. If he didn't like the answer at UPenn, that was the third opinion, guess what? They're going to the next best hospital and they're
Right.
going to keep going and
Right.
going and going. This is your child. You don't just
Right.
stop. I actually asked my dad because I had my own theories, my own ideas of why are people afraid to get second and third opinions. He and I had some overlap with our theories, but I had some different ones. He said because he gets people coming into his office all the time for second opinions, and he's like, a lot of people are afraid of confrontation, or they're afraid to like disappoint their doctor or make their doctor mad if they
Wow.
insinuate maybe that they
Mm-hmm.
want a second opinion.
Mm-hmm.
Maybe they're afraid of like, what are the repercussions of this? Will I get worse care, worse treatment if my doctor thinks that I'm questioning or doubting him? So that's maybe one idea. I think
Sure.
another idea is it's sad, it's logistical. Yeah, it's time. For example, if it takes months and months to get into a new doctor's office, but
Oh yeah.
now you have a very urgent situation,
Mm-hmm.
what are you supposed to do, right?
Yeah.
And then sadly, coverage,
Yeah,
insurance.
for
Yeah.
sure.
I think just an element my dad didn't mention was, unfortunately, I think a lot of people have woken up over these last few years. I think a lot of people are asking questions that maybe they wouldn't have before. But I also see a lot of people, that are like treating certain news outlets like they're idolizing them, trusting every single headline,
Mm-hmm.
handing over way too much like sovereignty,
Yeah.
power, authority because someone has certain credentials behind their name. You, ironically, I would be trusting the doctors who can honestly tell me, I don't know, but we're going to find out, as opposed to the ones who are like, this is what it is.
Yeah.
I'm right every single time.
Yeah.
No, show me the doctor who can admit when you were wrong, you
Yeah.
know?
Yeah.
I don't know. What do you think?
Yeah, I mean, I do think that so I like the first thing that you said that your dad had mentioned about like not wanting to question like the provider or almost like let them down or maybe they'll receive lesser care because when we had spoken with the surgeons that we ended up choosing and we had them on the podcast, they did say they were like ask the questions, like ask them how often they do these types of procedures and this and that, and they're like, and if they get defensive, like that's kind of your answer. Like if
Yeah.
they A can't produce the information or if they get like aggressive and defensive, like they're probably not the right one for you because they should have enough like care to want to sit with you and give you those answers and not get frustrated and annoyed by them because they should have enough hope in like the procedures and things that they do. So I do think that I do agree with that. Like I do see like people want to be liked and accepted, right? They don't want to like a lot of times they don't want to like ruffle feathers, and so I could see that, and then the fear of not getting the right type of care because maybe they asked too many questions. Like could you imagine
Yes.
that feeling? Like that would be horrible if and especially if it was just here but like something happened and you're like, well, this is because I asked them too many questions. Like
Oh,
in the back of
yeah.
your mind you would think that for sure. For
Yeah,
sure.
that's very strange to me. Like if a surgeon is off put by someone asking too many questions. I mean, I was even talking to my dad, and it's funny enough, he would teach chemistry at the local community college because he loves to teach. If you can find a surgeon who also genuinely loves to teach, and they have no problem spending a lot of time with you, they want to pull up the diagrams and they want to talk you through things. They want to clarify your concerns. That's the one you want, not the one who
Mhm.
doesn't want to teach. That's bizarre to me.
Yeah.
As soon as I would get those vibes, I would just run. I would just drop them, like they work for you.
Yeah. But I have also had conversations with patients that have said, and it's more of like the older generation now versus like our generation,
Yeah.
where they're like, honestly, if I had to pick like a surgeon with horrible bedside manner and one that was like super loving and caring, I'm going to go with the one with the bedside manner because they're going to do a really good job. And I'm like, but why do you feel that? Why do you feel like because they're rude to you or
That's
like
funny.
dismissive that they're going to be the best of the best? Why wouldn't someone that's caring
Yeah.
and has time to spend and connect with you because there's a difference. You can have the same 5 minutes and connect with someone and they feel like it was 30 minutes, or you can have the same 5 minutes and feel like it was like 30 seconds. So it doesn't need to be like an extension in time. It just needs to be genuine.
Yeah, I think that that could be a trauma response, and I don't know. I don't want to lump in like all boomers together,
Yeah, yeah, for sure.
but there's a lot of things that came out of the boomer generation that do feel like a trauma response to me, and I almost wonder if they're equating like, tough and stoic with like, this is a good quality teacher, like this is discipline, you know?
Yes. And the other thing I was going to mention is when we were early on and I was doing a lot of research and these different procedures so we could like decide on like who do we even interview and like what's the right path. I was watching like somehow like they just have them on like YouTube and stuff. I was watching like their trainings and their CEs and stuff between these different surgeons. And
Oh,
I picked up very early on that there was like some top tier ones, right? They were like trendsetters in their space, but whew, it was like a divide. You were on one side or you were on the other. And so
interesting.
they were like, like down, like talking down upon like a certain procedure or something and how it wasn't the best one because of this, this, and this. And I'm like, ego.
Yes,
Ego
yeah.
can
Well,
be another
Across the
thing,
board, yeah,
which
with
should not affect the
surgeons.
patient. It shouldn't have nothing
No,
like that shouldn't even be a thing.
right.
there's
It's
also
what,
so many different ways to
Mhm.
do anything. I'm mind blown that it took three specialty surgeons to say maybe we should start from the outside in versus
Yeah.
just
Right. It was my
cover
dad's
skull.
idea. It was
Yeah.
my
Oh, yeah,
dad's
it didn't even,
proposal.
it wasn't
Yeah,
even, so that is mind blowing, but we had
right.
completely different, but along the same lines. There were multiple ways to do our son's surgeries, and some of them to us who are not trained in the field at all just didn't make sense. We just were like, that will fail. That will not work. We
Right.
will be back for multiple surgeries to fix this if we go with this doctor. We just know it.
Yep.
Yeah.
And so how that can happen when you like, I think a lot of people think a doctor is a doctor in a certain field. They're all trained the same, but the reality is that
Mm.
they can give you wildly different outcomes.
Completely. Also, like their personality type, like how ego driven are they? Are they set in their old ways? Are they
Hmm.
open to change and learning new things? Like, I want to go to the surgeon who is excited to learn about new technologies, who's okay being challenged,
Yeah.
who doesn't get defensive. Same thing. I'm thinking of birth. Like, of course, I don't want
Hmm.
to go. If I had to go to a hospital, of course, I don't want to see the OB who's like, I'd give routine episiotomies and use forceps and vacuums. Like, okay, this isn't the 1950s. Like, you
Right.
got to get with the program, people.
Right. Right. Well, right. It's okay to evolve and change. It's okay for it to evolve and change in the actual schooling itself, right?
Yeah.
Like obviously like more technology, the things are going to change over time. But I think also from like being conservative and being holistic and more wellness, like the extreme of like going from the inside out versus starting on the outside is like
Oh, yeah.
crazy is like just a crazy thought. So like I definitely admire and kudos to your dad for like asking. I mean, I think he could ask because he was like inside of the industry and like learning and stuff, but like parents would probably never ask that. But
Yeah.
I
we
don't
were
know.
just like,
I was thinking about it the whole time when she was telling the story from the get-go. It's like, why are we just going to that? Like, what?
yeah,
Right.
like,
So
can we do
extreme.
anything conservative first, And
Right.
then, like, if it doesn't work, then we can go. Like, you can't reverse going,
Yeah.
going from the cranium.
Seriously. It just shows, like, they're so deep in this microcosm, these surgeons, like, opening up a 1-year-old's skull is not a big deal to them.
Yeah, yeah. Well, and
We have to remember this.
I do like that you had mentioned that in the way that you had, even said like your parents were like on the floor and they saw, these kids and leaning over and stuff because that's the experience we had with the first thing that the first person we talked to in St. Pete. It was very much like glossed over, like this is like it was just like we were a ticket, we grabbed a ticket at the deli line.
Yep.
This is the number, this is what he has. We'll see you in 8 months. And I was just like
We knew when we walked out, we're like, we're not going back
devastated.
there.
Yeah.
We
Yeah.
won't be there.
Yeah,
Oh, yeah.
devastated.
It's like going through McDonald's. Like, okay,
Yeah,
what's your order? All
yeah,
right, bye. Yep,
yep,
see you next week.
yep.
No,
I'm like, that's
yeah.
not and we're cash pay. I definitely don't want. we're definitely not even using our insurance,
Oh,
and
yeah.
so it's almost like I know they don't care, but it's almost they should like flag it and be like, hey, these people are cash pay. Like send some,
Seriously.
like they have a choice.
Yes.
They can go
Wow.
write a review, which I guess they don't care about that. It doesn't affect their industry as much, but
Yeah. Yeah, that's fascinating because I always just assume too, we're cash pay for a lot of things. We only have insurance because of my husband's company, but otherwise I'm sure we probably wouldn't. But I just assume, yeah, you get more time, you get more care when you're cash pay. Wow.
Yeah.
Not always, not
Well, not
always.
always. And additionally, it was really hard to get in to see them. And it's almost like they almost wouldn't like let you in. And the end, the handoff at the end was very different. Like that's a whole different conversation because it was very much like they did not force us to schedule because they're like, well, like I'm like, I need a quote, I need to know how much it's, all asking all the questions. And it was like, oh, okay, well, like call us if you're ready kind of thing versus like I
Mm,
know if we were insurance it would have been on the schedule. It would have already been done. It would have been, all the steps would have happened. So there is definitely what you would expect to get being cash pay was not even. It,
wow.
it was like insurance and then below, I feel like.
Jeez. Yeah, like chopped liver. Yeah, such
Yeah.
a business. Mm,
Yeah. So yeah, that was really
mm.
obviously really unfortunate. But again, like we feel validated in the decision that we made and the experience that we had with where we did go. And because of the way that that doctor reacted, I
Yeah.
was like, absolutely not. You would
Yep.
never touch my son.
Yeah. And I think when we have those mama bear instincts too, or papa bear instincts, it's so much easier to get those fourth and fifth opinions.
Yeah, for sure. For sure. Let's talk about informed consent because I think, like we had tiptoed around earlier, it's more than just like signing the informed consent form. I it's just so much more than that. And how do we get listeners to understand and to empower and to give them some things that they can ask or feel validated in asking?
BRAIN, the acronym BRAIN. What are the benefits, risks, alternatives? What's my intuition telling me? And
Mm.
N is either what happens if I do nothing, going back to like what my dad said, what happens if we just wait it out? Well, then it's going to get bigger and bigger. She'll go blind. Okay, so we're not going to do nothing. And then, or no. So I've used this acronym. I didn't make it up. I heard it from somewhere, but I've used it for almost everything. And I think my biggest pet peeve, though, is when providers say, like, there are no risks, because even with healthy things you do, there can be risks if you
Yeah.
do too much or like at a certain time.
Yeah.
Even with like any kind of like healing modality, like there can be risks, even if you take healthy herbs, like while you're breastfeeding, there can be
Hmm.
risks. So
For sure.
even just by someone telling me there's no risks, that would flag this provider in my head. That would be
Mhm.
like one strike and you're
Yeah.
out sort of thing. Like,
Yeah.
okay, let's see what else you say. So here's what really should happen is we shouldn't have to do the BRAIN acronym. In a perfect world, our providers would just volunteer all this information. They wouldn't hold back. They would put their personal biases aside and they would objectively just, whether it's showing you the package insert and telling you exactly what's on it, telling you all the risks and side effects, and also, you know, hey, you don't have to do this thing. Like, here are the odds of things just kind of panning out if you were to do nothing.
Right.
What I think, I actually have had this conversation with my dad too over the past few years. Like, why is this so hard to actually get informed consent? And he said, well, I've always told my patients whatever it is they want to know, I'm going to tell them. Like, I'll tell them all sides of the coin. The problem is sometimes there can be so much information, like
Hmm.
just so many. He said, here's where it gets murky. It's not that we're trying to conceal anything or hold anything back, but there's so much that could possibly happen that we don't even know about yet.
Yeah.
With our litigious society, it's like, okay, you'd need a whole textbook to be like, here's all the possible things I can't even predict that might happen to you, but I
Hmm.
don't know if they'll happen to you. Okay, now we need like 2 hours to have this conversation, which
Yeah.
nobody has. But, or I can give you like 70 pages and then you can sign off on it. So I do feel like there has to be a happy medium.
Sure.
Obviously, the pendulum has swung and it's like providers like, no risks, it's safe. I think the informed consent conversation has devolved into something kind of dumbed down and watered down, which is like, I don't think the risks are that important enough to share with you. And I don't think this is a big deal. So I think you should just go for it, you know?
Yeah. 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 I can definitely see that. And I think, like you said, because they could go home with like a 70-page document, but then what's the reality? No one's going to read it anyway. They're just going to sign it.
Yeah.
There's very few people would go through all of that, and dive
Yeah.
in. So then it's like on the provider side, it's like, well, they're not going to research it anyway. So like, what does it matter if I tell them? They just may
Yeah.
be like the one in a million chance it may happen to, and then we'll handle it then.
Put it in ChatGPT and ask for the questions that you want to ask.
Oh, gosh.
Yeah. I joke it's like an Apple iTunes agreement. All these contracts are. Nobody
Yeah.
reads the Apple iTunes agreement, but
Yeah.
you know you're scrolling down to the very bottom. I
Yeah.
accept the terms.
Exactly.
I don't even know what I
Yeah.
just signed away my life to, you know?
Yeah. Yeah. They probably have access to our whole entire data, I'm sure.
This right now, right?
And we're like, I
Exactly.
just want to listen to my own podcast, okay?
Yeah. But yeah, in terms of informed consent, I mean, you can still go through the acronym. It doesn't
Yeah.
mean you're going to get the answers you like because oftentimes, the provider is, you have to remember two things. One, a provider is going to put their own personal and professional like experience, the lens that they see life through into this conversation. It's going to end up in there somehow.
Hmm.
The other thing, often, if you're going to see a Western medicine doctor, there's any allopathic practitioner, you have to remember that that is their training.
Yeah.
So they're not going to be, when you're asking alternatives, the A in the brain acronym,
Yeah.
one, they're not going to know, like, to even tell you, like, look into chiropractic care, acupuncture, herbs. But two, like even if they did know professionally, legally, they can't be giving you that guidance. They're not certified in that.
Right.
And then why would they want to send business away from
Hmm.
themselves? It reminds
Hmm.
me, I was seeing a dermatologist in Manhattan maybe 10 years ago. And even though she was a dermatologist, she was very open-minded. And I was like, look, I don't want to use products with, parabens and phthalates, da da da. Like, and she said honestly, like you can bring in these other products for me. Like she wasn't dismissive, she was open-minded and actually like willing to learn from me. She said, I don't have training in Western or Eastern herbs. I don't know what these ingredients are, so I can't actually tell you whether it's like okay. I don't know the efficacy of them.
Hmm.
So if you like, you of course can do your own research and experimentation, but like she basically admitted like this is all I know.
Yeah. Yeah. Well, I applaud her for that though. Like
I
owning
know.
up and saying that. And because, and like you said, like I think more and more people are getting like into other things, right? Some like holistic routes possibly.
Yeah.
And if you do go and ask your medical doctor that's trained in their way, like, hey, what do you think about chiropractic? What do you think about acupuncture? What about, this or that? They're not going to know. So
Yeah.
they're not the best person to ask. And
Right.
so maybe when you're using that brain acronym, if there's not an A that they recommend, know that more than likely there is an A out there. You're just not going to get
Right.
it from them. So do due diligence on the backside and then go and interview those providers and see what they say.
Right. Like, don't ask a lawyer for real estate advice. Like, okay, what are my alternatives with this? Like, you're
Yeah.
going to have to go ask this individual. And that's why we have different niche, practitioners.
Yeah, for sure. For sure. And I do feel like there's an ego thing there too a little bit. It's like,
Oh,
well,
yeah.
if I can help you, like there's no way that's going to help you versus like I'm a big proponent for like co-management and that the
Yeah.
patient in front of me is the one that's the most important. So like how do we get the patient to achieve their goals? And it may not just be inside of one office or with one modality. It could be with multiple different things because healing's not linear and
Absolutely.
and management of conditions is not linear.
Oh,
So,
yeah.
when we talk to some of these parents and their medically complex children, some of them that are very complex have like 7 specialists, if not more. So,
Yes.
and in that complexity, it's okay to have all that, but I also don't want to downplay that if the condition's not as complex as others, it still deserves like due diligence and proper management, and that may be with different providers to just get the
Exactly.
best outcome.
Yeah, and some things will actually resolve on their own without intervention, and some things will resolve very gradually over time. And maybe it is better to nip it in the bud earlier versus in 10 years and maybe not. So there's a
Mhm.
lot of nuance to this whole like the A in brain for
Yeah,
informed consent. Yeah.
for sure. And I love that acronym. I mean, I think that's such a great piece of information, and hopefully everyone writes that down. Put
Yes,
it in your
use your
notes
brain.
section.
Don't
Yes,
forget.
use your brain.
Yes.
That's beautiful. How I feel like how would someone feel like they have all the informed consent that they need to make a good decision?
You're not left hanging with any questions. I think it's okay to have uncertainty as to the outcome because nothing in life is a guarantee.
Correct.
So we don't want to use the feeling of uncertainty as our litmus test. You just need to sit with yourself and say, like, do I trust the person where this information is coming from,
Hmm.
to whom I asked brain? But do I have any outstanding questions, right? Like there's risk in everything.
Hmm.
So oh, it's not your provider's job to take a, like, yes, we want them to mitigate the risk. They
Yep.
cannot guarantee the outcome. You have to sit with, like, what are you most comfortable waiting, giving this more time? Do you want to take action now? Um, this is also where intuition has to come into play. The
Yes.
problem is we can sit here and talk about how wonderful and important intuition is, but we also need to reconcile that with people have severed intuitions nowadays for lots of
Yep.
reasons. We've been
Yeah.
outsourcing too much to AI,
Hmm.
to experts in white coats. We've been proven wrong on certain things, and then we think that our intuition is always going to fail us.
Yeah.
Right? Like we have to admit, like sometimes when we thought something was going to work out and it didn't, that is how people have severed intuitions.
Yeah.
The way that you rebuild that intuition, though, is it's hard. You have to start from somewhere, but ultimately, if you are leaning towards something, like leaning towards a certain outcome or result, and that outcome is proven to be true, well, then you can say like, oh, cool, my intuition was right. You need to start to be right about a few more things usually,
Yeah. It's like
because
validating that when things are working, like when your intuition is correct, validating it because we're
yeah,
so programmed to go to the negative. No matter who
yes,
you are, that's just like human nature. We're like
yeah,
programmed for fight or flight and survival. And it's, of course, it didn't work. So showing
yes.
up for yourself and saying, okay, it did though. Like this was an instance that it did. Like I can trust myself.
Yes. And so it's really hard if you don't have that trust in yourself currently
Mhm.
because you will have to take another risk and be like, okay, I need to try to trust myself now. But with intuition, you don't necessarily need a reason why you feel a certain way.
Mhm.
If you have 10 different voices in your head or like you talk to 10 different experts, you just need to sit down and maybe journal about it, do some meditation, get quiet and be like,
Mhm.
why do I trust these experts and not
Mhm.
these experts? What is it about their demeanor or their body language or like what they said that I
Yeah.
like or dislike? You
Yeah.
need to start from there and then you need to see if you were right about it or not. And then you
Yeah.
need to stack those successes.
Yeah, I love that because I think too, like, especially this day and age with so much technology and input from everywhere, like, we can't even sit in the stillness of our own brain and bodies and like really listen. And it's like, if you could, even for 5 minutes, you had all the information, right? You did all your due diligence and you got all the information, but you just actually just sat in quiet with it. What would come up? What other questions would arise? Or which option? Because your body will tell you, especially if you're connection with your intuition, like you will know what you feel most comfortable with. I mean, this is your mom gut, this is your parent gut, right? This is why parents push so hard when something doesn't feel right because it's in there.
Yes.
That intuition's in there, but we also should listen to it in other ways.
Yes.
And if we're too loud and we're looking for someone else to solve the problem, you may not get the alignment that you're looking for.
Yeah, exactly. Don't let your guard down and expect someone else to fix things for you.
Yeah.
You're leaning on consultants, but ultimately you get to make the final call.
For sure. And I do want to like highlight that I think one way that you can make sure about this and have that time for reflection is it's okay to record these conversations with your
Yeah.
provider. Like for your own use, like record it so then later you can go back cuz there's only so much you can remember. And if you are stressed and in fight or flight when you're in these conversations, especially if you're someone that's not used to having a conversation where you're questioning somebody, like
Yeah.
just have the recording so you can go back and listen to it. And then you can write your notes down and you can, say that felt good or that didn't feel good. And this is why. And maybe I need to ask this additional question before we move forward to make sure this is the right person for me.
Absolutely. You should not
Nothing
be
wrong.
making decisions under duress. And this is challenging because well, unfortunately, there are some medical situations where it is very much, are you going to live or die in this very moment? And then,
Yeah,
yeah, you're going to have to make a decision under duress. But
100%.
if that isn't the case and time is on your side, talk to as many people as you need to talk to. What are the common denominators you see, right? Pattern recognition.
Yeah. Yeah, and I've even heard this like in the birthing world, right? Like if you're, in a hospital birthing and they're like this has to happen right now, and you're just not sure, like ask for like a moment to pray with you and your husband or you and your
Yeah,
partner, and it's like just getting like that can be a moment as long as it's like not life or death. Like if you can take 3 minutes to yourself, like maybe you'll have some clarity.
absolutely.
Yeah. So that was really good. Really, really good. Okay, beautiful. We're like just crushing it here.
Yes.
I feel like I had some stuff on here like why do people feel guilty about seeking more opinions and pressure and making those decisions? But I do feel like we hit on that like pretty well earlier when we were talking. Um, I think it just goes back to just feeling like we're not allowed to. Right.
Yeah. Yeah, I can't personally relate to that because I was always the person asking questions in class. And I
Hmm.
mean, I had teachers in school who were like, if you don't understand something, ask. And I was always asking my parents questions. So personally, it's challenging for me to relate to that. But from what I understand, it's, I don't know, a fear of hierarchy or a fear of getting in trouble
Hmm.
or something. But you just got
Yeah.
to throw that out the window. Remember, they
Yeah.
work for you.
Yeah. Oh my
You're
gosh.
paying them.
Yeah, I feel like I could like deep dive into this rabbit hole. I'm like, oh, well, it's probably something in your childhood and like,
Oh, yeah.
your trauma and all this stuff. But like even for like me, like I'm usually like very like soft spoken and I don't rock the boat. But man, when it comes to medical things, because of all the stuff that I've been through from losing my brother early on and just, like being inside of the holistic space and then navigating this with our son. And I'm a strong advocate in a medical facility. And I
Yes.
don't maybe sometimes come across as like the nicest when asking these questions, but it's because of the pushback that you get. And
Yeah,
not
we're on the defense.
right, we're
Sure.
on the defense because of the experiences that we've had. So it's, that like fine dance
It
with
really
it.
is. Yes.
Hmm.
And feelings have to go out the window. And, doctors are used to this. Like, feelings have to go out the window. You just need to get to the truth, really, for the
Yeah,
sake of your child.
for sure. Absolutely. What are some good ways to stay grounded when you're inside of those like I don't want to say heated conversations, but they're important, right? They're like really stressful. You're trying to gain all this information. Maybe you do feel dismissed or maybe you feel heard. Like how do you still stay grounded inside that space?
Um, you always just need to take a deep breath.
Hmm.
And yeah, your blood could be boiling inside. Maybe the practitioner said something to annoy you. But I just like to take a deep breath when I'm feeling really ticked off by something and then go,
Hmm.
like I'm thinking about it. Sometimes it's just ways to buy time so that you don't explode or maybe say something you'll regret, or
Sure.
you can repeat the question back to them, like, so you're saying da 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 da, you know,
Hmm.
say their question back to them. And you don't have to, this isn't like a court of law. You don't have to give a response immediately. You
Yeah.
can always just be like, yeah, you can be honest and say, I'm not sure. I actually have to think about it. We're going to talk about it at home and think about it.
Hmm.
You know, we'll
Yeah.
we'll get back to you. We'll let you know, or just say, I like to say, okay, thanks for sharing your point of view. I'll think
Hmm.
about it.
Yeah.
Okay, interesting perspective.
Yeah.
You know,
For sure. And I'll say like I'll talk about this all day. I mean, it's relevant but not relevant like in the chiropractic world. Like we are a lot of us are trained in ways to like get patients to start care and different things, and it can be very salesy. And so there are offices out there that like will not basically let you leave until like you make a decision about care that day. And I don't do like that doesn't sit well with me like
Yeah.
in any industry. So like I don't do that. I'm like, you want to go home and talk to your husband? You want to go home and look at your finances or pray on it or whatever? Like go for it. Like
Yes. Let them
it's
come to you.
it's
I
your
agree.
it's your right.
Yes.
I was going to bring that up with the whole like, why do people not ask more questions and get other feedback from other people? A lot of it is sales, but I don't think it's that practitioners are trained in sales necessarily to just walk you through and get you to the end, but that's how it feels. Like I think a lot of people go into doctors and they hear this is what it is, this is how we do it. Boom, you're done.
Yeah.
It's kind of like you just, well, they're trained to do this. Like, let's just do it.
Yeah, and when
Yes.
people do ask me more questions, oftentimes they will apologize. They'll say, "I'm so sorry. I just want to make sure like I understand." Or, "I'm sorry to ask you so many questions, but it's important for me to understand." I'm like, I love these conversations. I much rather have a conversation like you asking me because you're not
Yes.
sure and you feeling validated and comfortable with whatever we're about to do versus in the back of your mind having that question and never bringing it to the forefront and then later just not trusting me. Because this works better when we trust each other.
Yeah,
It
I
works
have to
much better.
ask the patients that are apologizing before they ask a question. These are mainly women, I'm assuming.
You
Or
know,
are men apologizing too?
I've had it both ways, but
Really?
yes, but
Interesting.
yeah, I will say there are certain men that make it in my practice and there are other ones that do not. And that's just from
Yeah,
like, there are some that are like drivers and like really strong, like masculine, and those ones like you have to lead with this is this.
right.
Otherwise, they're just like not here. But I really enjoy seeing the ones that we can just have a conversation
Totally.
versus
Yeah,
it being
yeah.
like
Bottom line up
super
front.
aggressive.
Yes.
I
Okay,
don't know
no, that
exact
is interesting.
I don't know how exactly it relates, but I think it's interesting when I hear some of your stories about people going in for like a back surgery. To
Mhm.
me, like that would be like I wouldn't do that until I had exhausted every option. But sometimes it seems like it's almost harder to sell somebody on trying chiropractic because they quote unquote don't believe in chiropractors or something.
Yeah.
But they'll be like, yeah,
Yeah.
slice me open and put rods in my back without
Yeah.
getting it, even getting a second
Well,
opinion. And I'm
well,
always just
It's
mind blown by that.
fascinating.
yeah, and even though like that's like chiropractic specific, it is worth like using that as an example because right in that brain, like the alternatives, like if you like I even if your kid does need surgery and your kiddo needs surgery or whatever or yourself, but we're not like the surgeon's not open and accepting of the alternative, which actually could make a big difference, they're
Yeah,
going to make it sound like that is not an option.
for
They're
sure.
gonna cut it for you and be like, no, that there would no be it is not safe to go to a chiropractor. And meanwhile, like we're saving people from surgery each and every day if they're willing to come in and trust us, you know?
Absolutely. That kind of mindset where it's like, okay, my first resort is going to be a major surgery. I'm not even going to look at chiropractic. It's the same thing, you see in pediatrics, like ear infection, antibiotics.
Yeah.
Not like, what about garlic
Yeah.
and,
Yeah.
malign oil? Like, oh, why not?
Or even like telling them that like half the time at least like they're viral, so like the
Yeah,
antibiotics aren't going to do anything. Like
exactly.
why can't we have that conversation, you know?
Totally.
You know,
Yeah.
or give an alternative to Miralax for constipation like
Yeah. Or, Ozempic instead of just let's move our bodies more
oh,
and eat
yes.
better. You know,
Yes. Yes.
we do very much live in a culture. It's fast paced. There's not a lot of time for trial and error.
Mhm.
We're tired.
Mhm.
We want magic pills. We want one solution, one procedure that is going to make everything just go away. All our problems go away.
Mhm. Yeah. Yeah. It doesn't work that way more
We're
often
scared
than
of
not.
discomfort. We do have a comfort crisis in our culture.
I agree with that for sure. For sure. And guess what? There's plenty of time in life that you should be uncomfortable.
Yes, you can grow and learn a lot from it.
Yeah.
It's what makes you resilient.
Yes, for sure. I totally agree with that. I would love to like highlight just some things as far as like social media goes, like and mom guilt, parent guilt. Like I felt this a lot
Mhm.
going through our process with our son, like being inside the groups and then and they're just being like the information, the parents are there for the most part to mean well and to connect with other parents and like help someone navigate something. But I felt like it was just almost like a toxic culture too, to an extent. And
Yeah.
that's, I think that's also just bringing it back to yourself and like knowing what you need and you don't need. But it's hard because in this like social media era, like I had better connections when I could connect with someone in person
Yeah.
and like talk with their experience and what they went through, but like not at, good luck trying to find someone sometimes, depending on like what you're trying to connect on. Like there was one mom I knew, and
Yeah.
I'm forever grateful for that. But then you go to these groups or you're on, Instagram or something, you see these things, but then easily it can go from a positive to a very negative
Yes. Well,
feeling.
there's keyboard warriors. So you have people who would say things online that they wouldn't dare to say to that same person face to face. So you
Mm-hmm.
have that situation. And of course, we need more in-person connection. It's hard with people's, schedules with work and with kids. Of course, that's the gold standard is meeting face to face in person.
Yeah.
In terms of social media, going back to the comfort crisis, like there's just on Instagram, it's just all, sound bites, clickbait, it's short form content. And unfortunately, it's like you have to play into it a little bit in order to get people to your long form content,
Yeah.
the podcast, like don't hate the player, hate the game.
Yeah.
The best thing I've realized is like using a device like a brick or something, or if you're
Mm-hmm.
going out, is there a way that only one of you can bring your phone and like leave the other one behind in terms of just avoiding that world. But yeah, it is challenging
Mm-hmm.
doing the in-person meetups, right? Because people have like, okay, their work stuff and then it's kids and then it's bedtime. So it would just be on the weekend. But yeah, social media, I have such a love-hate relationship
I
with it.
know. Don't
It's
we
helped
all?
me a lot, with the
Yeah.
podcast. You have to just hop on, do your business, get right back off.
Yeah. Yeah. I think it's easy to get wrapped up into doom scrolling or whatever. But I think too, like I would love to like encourage listeners, like if you do find yourself doom scrolling, then maybe we need to look into some other things, like no matter if it's breath work, meditation, journaling, whatever, aligns with you. And this is a good indication that maybe you need to start exploring some of those other options because
Definitely.
we're suppressing or we're not addressing what's really going on internally. And
Yeah.
for caregivers, especially with very medically complex children that have lifelong conditions, like they're burnt out, they're exhausted, they're trying to escape. But I would love to empower them to have some tools that could move them in the right direction.
Oh, yeah. And I would say, like, just going back to the basics, caring for your own family,
Yeah.
avoiding the news. Like, I didn't
Yeah.
watch the Super Bowl at all. Everyone's talking about this Bad Bunny performance, and like, I haven't even seen it. I've only ever seen like the little, 10-second clips
Yeah.
online.
Yeah.
I honestly, I could give two shits. I don't know if
Yeah.
I'm allowed to curse.
You are.
Um, so yeah, I don't care about these things. And, I've waxed and waned with like how much I care about what's going on in the world at any given point in time.
Yeah.
But when you're in the thick of parenthood with two toddlers,
Yeah.
you have a podcast going, it's like, here's the thing. We all know, yeah, the files are atrocious. The Epstein files. Like, there's bad things happening all the time. It's never going to stop. Is this doing your nervous system any
Mhm.
good to be taking it all
Yeah.
in, all while you're trying to parent, and especially if you're
Yeah.
trying to overcome, a big illness? So,
Yeah.
we have literally one TV in our entire home. And Eric and I, like on the weekend after the kids are asleep, will watch a really good quality movie. But I don't, maybe this is more of a boomers thing where they're still watching cable and like they're glued to
Yes.
MSNBC for
Yes.
hours at a time. I think that is such a boomer thing. And they're actually, now that they're in like this retirement age, I see them more glued to their phones than like even Gen Z. Like
Yeah.
they're doom scrolling. So it's not even necessarily like a younger people thing anymore. I very much see it in the recently
Hmm.
retired.
Yeah.
But yeah, experiment with like leaving the phone at home,
Yeah.
go back to analog whenever you can. I know it's tricky and just make normal conversation with the moms at the park. What I've learned is you can't be too picky. If you want to invite people in, and I'm still working on this myself, but if you want to invite people into your circle, just accept the fact in advance. You're not going to align on every topic, and
Sure.
that's okay,
Yeah. Yeah. And I love that. And I would love for more people to feel that way because I actually just had this conversation the other day with some people because they were like back in the day before like again before as social media got as big as it was like you could have a different opinion and you guys could talk about your different opinions and still be friends and it was fine. And now
Yeah,
it's like not fine. And for me, I'm like I have friends that have all kinds of different opinions than mine. And that's okay.
same.
We can still find common ground on a lot of stuff, which is why we're friends, but like I don't I mean, you do you, like
Exactly. I was
seriously,
talking to
like
my mom about, like, I said, when do you think this started to happen? Because throughout my entire childhood, my mom has had really close friendships with women who, didn't exactly align, but we were like, and I was close with their kids. Her prediction is, tell me what you think, around 2008 with like when Facebook became more mainstream. So in
yeah,
2005 it came out, 2008 everyone's
yep,
starting to plaster their very divisive political
yep,
opinions on their
yep,
Facebook feeds.
yep.
She said 2008, the
Mm-hmm.
election and Facebook is when it all went to shit. And you could only
Mm-hmm.
be friends with people who thought exactly the way you did. It was like you're either good or you're evil.
Yeah. I mean, and that's what those platforms are so used to like really sway and change people's opinions. And that's, I mean, I think there's a documentary about this like a little while ago, probably longer than I can realize on Netflix. And it was like all about like how, I mean, we know this. We can talk
Yeah.
and our
Oh,
phones are
yeah.
listening and stuff comes up for advertisement that you were talking about. So like it's not like this
Yes.
isn't our opinion. Like this stuff
It's
is
not
like
a conspiracy.
obviously like out there and happening. And I think, like you said, like trying to disconnect as much as you can or like leave one phone at home and that kind of thing. Go for a walk without your phone. Or if you have your phone, like
Yeah.
don't turn anything on. Just like leave it in your pocket. So if you have it, if you have an emergency, like it's there, but just like reconnect with like the elements, like being outside
Yes.
and breathing and like remembering that like you're part of this great world and there's so many things going on. I heard a quote like not too long ago that like people are going to have more memories of other people's experiences than their own because of
Dark.
everything that they're seeing online versus actually going out and living their life. And that changed me and it made me like put my phone down more because I don't want to remember anybody else's life more than my own.
Same. That is disturbing when you put it that way. Yeah. And we've all fell victim to the scrolling, and like you guys don't feel guilty or ashamed about it because these algorithms are designed to be
Yeah.
addictive. That is why self control and discipline is not enough. Like sometimes you really just have to lock up the phone,
Yeah. Yeah.
literally.
For
So,
sure.
yeah.
For sure. And there's devices out there and all that stuff that they can look
Yeah.
into to do that. But yeah, just reconnect. And I mean, I just brought that up because if you already are going through something and it's stressful with your child or, a loved one, don't you want to spend the most like relevant time that you can? Like, of course, we want to
Oh, yeah.
escape, and self-care is very important to make sure that you can be the best care provider and to take care of yourself because, you can't pour from an empty cup. But let's go back to being a little bit more present too and being thankful for, the situations that we have. And I mean, this is, just being present with them
Absolutely.
because they'll appreciate that for sure. So, well, girl,
Yes.
I could talk all day to you.
I know, same.
So
This was
I
so
love
fun.
it. It was so good. I want you to just give some shout outs to like where people can find you and your information so they can follow along as well because you got some really great content out there and let's just keep
Thank
empowering.
you. Yeah, so I would love to see you over at Moms Off the Record Pod on Instagram. I'm trying to be, well, speaking of
Yeah.
phone usage, trying to be a little more active there, but then jump right back off as
Yeah.
soon as I
Yeah.
post. But yeah, I run a private community for this is my little daughter over here. She's making all these cute sounds, but I run a private community, a membership community for moms who basically feel alone in their holistic journey of any sort, moms on all stages of the motherhood spectrum.
Love it.
And it's a great support community. There's resources, there's a forum. Um, yeah, all sorts of insider fun updates. And then, of course, Moms Off the Record on Apple and Spotify. Definitely
Mhm.
tune in. New episodes go live every Tuesday. And you can also book a here, let's look at this. You could book a one-on-one for potty training. So I help with all sorts of potty training, troubleshooting. That's at katherinesigblad.com. So yeah, I'm trying to think if I forgot anything, but I don't think so.
Yeah, I think you got all the things and I look forward to like following your adventure too with your
Oh,
move.
thank you. That's right. Yeah. So
Yeah,
yeah, moving to Sweden probably around August time. It'll be
cool.
really exciting.
Yeah,
Yes.
and go follow Kat because I'm sure you'll post about it and like
Oh,
share about it on your
yes.
podcast and like I'm sure there's people out there that want to know what it's like living internationally, like living somewhere else.
Yes,
We
definitely.
do. I'll follow it.
Yes, thank you.
Yes. Well, it was such a pleasure. Thank you so much.
Thank you
And
for
I hope we'll
having
chat
me.
again soon.
Yes, definitely. Thanks, guys.
Thank
Yeah.
you.
Thank
You
you.
have a great rest of your day.
You too. Bye.
Bye. And as we close this conversation, I want to leave you with this. Seeking a second opinion is not disrespect. Asking questions is not rebellion. Taking time to decide is not negligence. It is responsibility. There is a space in the world for medicine. There's a space for holistic support, and there is a space for parents who thoughtfully bridge both. If this episode resonated with you, I encourage you to share it with someone who may need permission to pause before their next big decision. You can find Kat and continue the conversation over at Moms Off the Record. And as always, you are not crazy for asking questions. You are not difficult for advocating, and you were born for this. If this episode resonated with you, we'd love for you to take one simple step. Share it with a friend, another parent, or a caregiver who might need to know they are not alone in this journey. Make sure you are subscribed so you will never miss an episode. We release new stories every Monday. And if you're looking for more connection, resources, or ways to share your own story, come join us on Instagram at Born for This Stories, or visit our website at bornthisstories.com. Remember, whatever part of the journey you're in, the waiting room, the recovery, or the in-between, you do not have to carry it alone. We see you, we stand with you, and never forget, you were born for this.